Hey guys, welcome. We are doing a cheek enhancement today for this patient that is lacking some mid-face support, and we're kind of seeing those nasolabial fold deficiencies because of it. So I'm marking her up. I'm kind of just creating my safe zone, marking that out, and then eyeballing where I want to place that product. So here I am using Radiesse, which is calcium hydroxyapatite filler, and I am injecting this filler with the provided needle, and I'm injecting deep down on bone. So you can see here that I am using the syringe, placing the needle in the patient's tissue until I tap bone, making sure I'm right on that zygoma bone, and then placing some product on the bone. This product is going to kind of mimic bone, so we want it really nice and deep. And you can see here I'm using my non-dominant hand to kind of stabilize and then also pick that tissue up so I can be sure that I am indeed all the way on bone and I'm not tacking any of that more superficial tissue down. You can see here I'm feeling first with my non-dominant hand. Back here, kind of more posterior, the zygoma gets rather thin and narrow, so it's really hard to stay on zygoma sometimes, which is why I'm kind of palpating first. Here I am kind of working my way back, and then you'll see me work my way forward. Not much bleeding at all. I am giving a bolus injection right down on bone, and then I don't inject anymore and then come out. So we want to give that product right on bone and not kind of retrograde out. I can see there kind of where I just felt with my non-dominant hand that I was lacking some volume there. So I'm going back in and I'm going to give a little bit of product. Sometimes this syringe will get a little bit clogged. So if ever there's trouble kind of expressing that product, I just express a little bit onto a sterile field. The package that this product comes in is a great option and kind of unclog that needle. It's also not a bad idea to switch needles kind of halfway through, just because they do get dull from hitting that bone and it's a little bit more uncomfortable for the patient. You can see the patient does have a little bit of bleeding, nothing too bad. You can always take arnica to help with that. The patient is not on blood thinners or anything like that. We just maybe hit a little bit of a vessel. Here you can see I wasn't so sure I was on bone there. It felt a little odd, so I stopped injecting and I did not express any product there. I readjusted, and there I can see just by how my needle kind of stopped when I hit bone that I was indeed right on the zygoma. And I change my angle as that angle of the zygoma kind of curves and changes. So I'm always kind of a 90-degree angle directly perpendicular to the bone, just so that I don't slide off and we don't kind of end up in a space that we don't want to be in. Here I'm using gauze just to kind of place some pressure onto that spot that's bleeding and also support that tissue where I'm injecting. I'm going in and kind of filling any areas that I think need a little bit more volume in the same way that I have previously. Typically, I'm injecting about 0.1 of product with each injection. However, as I come more anterior, more posterior, I might taper that dose a little bit to, a little bit less than that, just because the cheek naturally tapers. These Radiesse syringes do have 1.5 cc's of product, so they contain a little bit more product than most other syringes. We're not partial to any product, but this is just the product that we felt would be a good filler for this specific patient. There is a biostimulatory aspect to this product. As it dissolves, it will create some collagen, which is really nice. It can pull some water, so the patient is fairly swollen right now. She was warned about that, and she knew to expect it. She can ice, and I told her, we don't want any crazy workouts following this procedure. Try to sleep a little bit elevated. We don't want her to manipulate the area at all. We really just want to be kind to our body and let it kind of heal in the time that it needs to. You can see the other side of her cheek has already been done. So look at that nice OG curve that we kind of see in the edge of this frame. It already looks so incredible. Here I'm going in and kind of just filling any gaps that I felt. I did assess from above. I always look to kind of come above the patient and look from all angles to make sure that we're really mastering that curve, that OG curve, and kind of correcting that mid-face deficiency how we want to. I am seeing this patient back in 2 weeks, so we'll kind of see how everything's settled, and we can always add more if we need to. I like to see my patients 2 weeks following the injections, just so I can make sure everything's settling okay, and once that swelling goes down, you can, really appreciate how that filler's looking. Here I'm just using some gauze with a little bit of arnica gel to smooth the area. This product is a little bit, you can manipulate it just slightly and kind of mold it. As far, as you get more far out from injections, it becomes more difficult. A little bit of a hematoma that I'm feeling there, but I'm just kind of making sure everything's smooth and integrated. Thanks for stopping by. Have a good one.